Hello, my name's Anne.
My name's Uribe.
And my name is Jack. Good morning. Today, we'd like to present to you some information about colon cancer, the risk factors to be aware of when dealing with colon cancer, and the ways in which patients can be screened. But first, I'd like to give a brief introduction to the disease that we'll be focusing on, which is colon cancer. It is the third most common cancer in men, the second most common cancer in women worldwide, and it affects over 1.3 million people globally. Colon cancer most often begins, as far as the pathophysiology, with the development of polyps, which are non-cancerous growths which develop in the colon as people get older. They develop on the inner wall of the colon, and over time, if they are not treated or removed, these polyps will develop and can frequently become cancerous growths, which can then metastasize and spread throughout the different parts of the body, which is something that we don't want. Colon cancer is a disease that develops slowly, so it is best to treat it early on, and the only way to do that is to identify developed in the body. Due to the early screening and because of the development of polyps as people get older, the target audience for our presentation today would be men and women aged 45 or older, those with immediate family members who have had colon cancer, and also people from underserved communities who may not have the access or resources to be regularly screened. And with that, I'll pass it to Zaribe to go over some of the risk factors associated with colon cancer and the types of screening that we have available.
Okay. Actually, I'm going to go over the risks.
Yes.
So, some people who are at risk are people with inflammatory bowel disease, such as ulcerative colitis or Crohn's disease, people that have a family history of colon cancer, so they have a parent or a grandparent who has had polyps or colon cancer, or various lifestyle factors, so physical inactivity, eating a low fiber diet, being overweight, alcohol and tobacco use, just living a sedentary life. And to go into more about people who are underprivileged and don't have access to healthcare, some risk factors for those people is education is the big thing. So one of the articles we found, it showed that mortality rates in Black men with less than 12 years of education are twice as likely to get colon cancer than Black men with 12 years or more of education, as well as non-Hispanic white men who have higher education are less likely to develop colon cancer. So a big risk factor is education, as well as socioeconomic factors. So colon cancer risk is linked to increasing neighborhood deprivation, such as poverty, the need for public assistance, and the need for education. And it also showed that Hispanics and Asians and people with low socioeconomic status have a screening rate of less than 50%. So a big thing is education and reaching out to people who are at higher risk. So Zaribe can talk about the types of screening.
All right. So now that we learned about what colon cancer is, those who are possibly who could be affected, and the risk factors, I now want to get into the methods. So before I start, I want to just talk about there are two main types of methods of screening. There's the non-invasive and there's the invasive. So talking about the non-invasive first, we have three in particular that I want to focus on. We have a stool DNA test. We also have a fecal occult blood test, and we have a CT colonoscopy. I'm going to talk about each one specifically now. So the first one I want to talk about is the stool DNA test. It's a test that's pretty much designed to detect altered DNA in the stool that is passed through the colon. It's actually has like there's certain markers within the stool sample that can be detected, and it's pretty precise. Cool thing is that you can actually take your stool sample at home. You can mail the test. The test kit will be mailed to you, and then you can bring it into the laboratory where it will actually be analyzed. As far as how often this should be done, it's so new, it hasn't really been determined. And there is no prep actually involved in this. So there's no withholding of any food or beverages or any laxative that's actually needed to conduct this particular test. Um, the next test I want to talk about is the fecal occult blood test. It's designed to detect occult blood. That's like pretty much blood that's not seen by the naked eye in this stool that may indicate colon cancer. You can pretty much collect this sample at home, and you can then, of course, having the kit already at home, and then you can take that to the lab again. And then this test is usually done annually. You can just basically check with your doctor in regards to preparation steps because sometimes you may or may not be able to eat, and sometimes you may have to withhold certain foods from your diet. So that's all going to be determined by your physician. Um, and that is a non invasive procedure. Again, the third and last non invasive procedure I want to talk about is a CT colonography. Basically, it uses a computed tomography to create both two-dimensional and three-dimensional views inside the colon and the rectum to detect pancreas growth. And as Jack talked about polyps, so it can allow you to see the polyps. Your physician will have to administer this test. It cannot be done at home. It only takes a few seconds with the scanner, and basically this test can be done every 5 years. You do have to fasten. You do have to have a complete cleaning of your colon. So that's going to require you to take a laxative before you have this done. And again, this is another non-invasive procedure. Now we're going to move into the invasive ones now. The first one, and probably the most popular one, is going to be the colonoscopy. It's a procedure that allows the doctor to take a look inside the rectum and the entire colon to check for cancers or pancreas, excuse me, precancerous growth, polyps, and with a thin, flexible camera. It's a tube. Actually, it's a tube with the camera attached to it with the lens, and then they can just be able to observe for those polyps inside or those precancerous polyps. And your doctor will administer this test while in the operating room. It's going to because there is some preparation in it. You're going to have to fast. You're going to have to take a laxative to make sure everything's cleaned out. There is an anesthetic that is going to be used in order to prepare you or to sedate you during the procedure. And this test is just pretty much done about every 10 years. Okay. The next one and the final one, which is an invasive one, is called the flexible sigmoid scopy. I don't know if I'm saying it right. I think sigmoid scopy, yes, and a test where the lower part of the colon and the rectum are viewed by the doctor with a sigmoid scope, and it's flexible. It's pretty similar to the colonoscopy. It's the thickness of the tube is like a finger, and small with the video camera at the end. Again, same kind of thing. You're going to need to be sedated. It's going to need to be done in an emergency office. Excuse me, emergency department, an operating room. And it's done. This one, opposed to the colonoscopy, is done every 3 to 5 years. The colonoscopy is done every 10 years. Same prep is involved as far as no eating. So you're going to have to be fasting. You're going to have to complete cleanse. So you're going to have to take a laxative. And this too is also considered to be invasive. So those are the 5 colon cancer screening methods that I would like you guys to be aware of.
So I'm just going to end this with talking about some ways that we can help the underserved. So one way that's not shown here is Medicaid has started this thing where they're doing telephone reminders to those that haven't been screened yet, and this resulted in modest improvements. So that's promising. And they also, some ways that they're going to start implementing soon is mailing people who haven't been screened yet, mailing them screening tests that Zuribe mentioned that you can do at home, and then you send it back to the lab. And that could be sent to people who are under Medicaid. And then there is a project called Project Access San Diego, and they are an example of a private organization that engages with the underserved community to provide screening and treatment services. So San Diego County's Community Health and Kaiser have linked together, and every year they host something called Super Saturdays, and it's for free diagnostic procedures. And it's also for just colorectal care. So if someone just needs an appointment and needs something checked out. Also, there is a new FDA approved blood test that it's just a regular, you go to the lab, get your blood taken, and it can detect certain markers in your blood that put you at risk for colon cancer. And it's cheaper and it has higher participation rates because it's just a blood test. It doesn't require any bowel prep or anything like that. So those are some promising new findings that could help more people get screened, and people in underserved communities are more likely to get screened with these methods. So yeah, that's our video. Thank you for watching.
Thank you.
Thanks.
Thank you.